cosmetic surgery procedure videos in Surat. Hair loss is very common problem and hair transplant is permanent answer to hair loss. Today we'll be learning about FUE method. Hair transplant can be done by both methods, FUT method and FUE method. So FUT method, we have different video for that. You can see on YouTube about that. This video will be describing how FUE method is helpful. FUE is very old method as such to be said when hair transplant started. But at that time it was not follicular unit. It was whole grafts were taken in 4 to 5 grafts and finally the look was not good. So FUE method at older times were lost with time and FUT method taken over. But with time new instrumentation developed and new drill machine and punches developed, so that now we can remove out individual follicles, and with that FUE method is again coming in market after very long time of 40-50 years. So what is FUE? FUE is follicular unit extraction. Now what is FUE method? We'll learn that FUE method on computer screen with PowerPoint, and later on we can discuss on this after the presentation. FUE is follicular unit extraction. Nowadays the drill machines are available, and on that drill machine there are punches available. That punches can be sharp punches or blunt punches. Depending on the skill and the time which is required and the thickness of the skin of patient, we decide whether the blunt punch or sharp punch has to be used for the follicular unit extraction. In the below figure you can see this, there is a hair and there are roots. So when the drill machine is inserted over the hair, and the drill will cut the attachments of the hair follicles to the skin. When the attachments are cut, the hair can easily be plucked out with its root and intact anatomy. So this is a very simple method to be seen, but it is difficult to practice. Sometimes in inexperienced hand what will happen is the direction of hair and the hair root are different anatomically. So when we try to pass out the drill will cut the shaft of hair and root will not come when we remove the follicle. So this is called transactions. So when you go to the doctor, you can ask your doctor about the transaction rate also. So this hair will not be lost permanently, but it will not be used in hair transplant. It will grow back on its own area later. This is again a graphical stimulation of how the hair follicle is removed. As you can see here in this follicle, there are 2 hair which are growing, and we are not separating the anatomy of the follicle, and that follicle as such is transplanted in the punch or the area where recipient area we can transplant it. As you can see, this is the immediate post-op picture of the follicular unit extraction. Here with drill we remove out, we keep one hair, we take out one hair, we keep one hair, we take out one hair, we keep one hair. So the hair are taken as the density of the posterior region or the donor region will be reduced by at least half, but nobody can make out when the hair grows from that area. But the hair which are removed by follicular unit, that will be permanently lost from that area. This is FUE healing. This is immediately post-op area. You can see multiple punctures, and this is on very 3rd day. On 3rd day FUE areas are healed and the new hair will start growing within 7 days. So FUE healing is faster and it is painless, it is stitchless, and even the blood loss is very minimal. As it is seen in this picture, sometimes this area and this area are at high risk of thinning. Only the area in between ears is safe donor area. FUT is taken from this area always. So the hair from FUT are very permanent. While if you want to avoid scar and if you want to go for FUE, you have to go to this area. So before deciding to go for FUE, you should consider your genetics. You should consider the baldness of your father or your maternal uncle. If they have baldness in this area, don't go for FUE only. Otherwise, this hair taken from this area will fall down within 5 to 10 years and they will not be permanent. As you have seen, that FUE is very simple procedure, and you can see how FUE method is done in the following video. If you have any query, you can contact our clinic, you can come to our clinic or visit our website.